Good evening, everyone. I'm Dr. Cindy Russell, and I'm president of the Santa Clara County Medical Association. I am very pleased to welcome you to session 3 of our Environmental Health Series tonight with Dr. Philip Landrigan, director of the Global Health and Common Good Program at Boston College, and also Dr. Gina Solomon, and they will be speaking on children's environmental health. So before we get started, I want to inform you of a few things. This is a 4-part series that's being recorded, and it will be available on the SCCMA.org website after the presentation, as all the other webinars in this series. The next and final webinar will be Thursday, June 3rd at 6 p.m. with Dr. Ted Shetler, who will be speaking on food and the environment, how our modern food system affects our health, planetary health, and opportunities for change. Dr. Shetler is Science Director for Collaborative on Health and the Environment and the Science and Environmental Health Network. He authored Ecology of Breast Cancer and co-authored Generations at Risk with Dr. Solomon, who's going to be here with us tonight as well, and In Harm's Way, Toxic Threats to Child Development. He has a wealth of knowledge and experience in health policy for children as well. Courtney Crenshaw, who's with Healthcare Without Harm, will join Dr. Shetler. Healthy food sustains us and connects us to each other and the earth, so join us for this energizing session to end our 2021 series. And just as a reminder to register for the last session and get your CME credits, go to events@sccma.org, or you can email Samira@sccma.org to register if you're not a physician, and she will register you and send you the link. So during this webinar, your microphone will be muted. We will take questions at the end of the presentation, and if you have questions, please put them in the Q&A box. If you'd like to speak during the Q&A, then raise your hand and we will unmute you. Also, just as a reminder, tonight's program is available for 1.5 units CME that you will receive after you complete your survey, and Samira will put the link in the chat box, and also you will be sent a link to the survey as well. So I would like to introduce now Dr. Philip Landrigan. He is one of the world's leading authorities on public health and particularly children's health. He's director of the Global Public Health and Common Good Program at Boston College and director of the Global Observatory on Pollution and Health at Boston College. He's former chair of the Department of Preventive Medicine at Mount Sinai School of Medicine. Dr. Landrigan is known for his many decades of work in protecting children against environmental threats to health. His research combines the tools of epidemiology with clinical and laboratory medicine. His studies played a key role in the government mandate phasing out lead components from gasoline beginning in 1975 and the federal ban on lead paint in 1978, culminating in an 88% drop in lead levels in American children by 2005. This is a true success story in environmental medicine. Dr. Landrigan is deeply committed to translating research into strategies for health protection and disease prevention. We're going to learn about the importance of environmental medicine tonight from one of a handful of global health experts in children's health. Thank you, Dr. Landrigan.
Cindy, thank you very much. It's a pleasure to be here with you with the Santa Clara County Medical Association, with Gina Solomon, who's been a friend for longer than I dare reveal. It's really good. So my theme tonight is, and I'll throw my slides on if you allow me to share my screen, which you did, is children's health and the environment. So that title, let's pause for just a moment and reflect on that title, because it puts together two concepts that we don't necessarily always consider in the same moment in time. When a lot of times when we think about children's health, those of us who are pediatricians think of children one at a time with asthma, with GI problems, with headache, with school problems, but we tend to think about the child as the individual patient. And then we tend typically to think of the environment as something that's out there. It's where we go when we go on vacation. It's where we go on the weekend. It's a place we visit. And what we often lose sight of is the fact that, in fact, the environment is all around us and it's even in us. And the health of the environment profoundly affects our health. And it especially affects children's health because kids are so inherently vulnerable to hazardous environmental exposures, as I'm going to detail for you in the next 30 or 35 minutes. So get this thing going. Uh-oh, I'm having trouble advancing my slides. Never a good scene. There we are. Okay, so here's the opening slide. the environment is a very powerful determinant of health and disease for kids. And one piece of evidence in support of that proposition is the fact that over the past 100 years or so, patterns of disease in children have changed enormously. At the same time, the environment has changed. Infectious diseases have gone down. Life expectancy has doubled. Now, the average life expectancy of an American adult around 1900 was about 45 years. Today, it's about 80 years, so it's almost doubled. And infant mortality is down by more than 90%. Chronic diseases, non-communicable diseases have come to replace the infectious diseases as the major causes of illness and death in people of all ages. And this switchover from a circumstance where most disease and death is caused by infectious diseases to one where the non-communicable diseases predominate is known in the public health trade as the epidemiological transition. It's never a complete transition. Anybody who's lived through COVID for the past year knows that the infectious diseases are still alive and very well. But nonetheless, when you take the broad perspective, it is the non-communicable diseases these days that account for the majority of disease and death in our population. This is a graph which I think illustrates over the course of 200 years what a powerful influence the changes in the environment are on human health. So this is a graph. The original hangs in the office of the New York City Commissioner of Health in Manhattan. And it's modestly titled, as you can see up there, The Conquest of Pestilence in New York City. It's sort of a typically modest New York statement. And what the graph is showing, this jagged line that runs across from left to right, is the death rate in New York City from 1800 till almost the present. And you see there's several lessons to be drawn from this slide. The first is that the background death rate in the 1800s was almost twice as high as it is today. And in some instances, when these great epidemics of cholera and yellow fever, typhus, smallpox swept through New York City, the death rate was 4 or 5 times higher than it is today. So what was the reason for that? Well, the reason is that on average, people lived only half as long. Yeah, to be sure, some people lived to ripe old ages. We all know about Benjamin Franklin, people like that, even though he didn't live in New York. But there was huge infant mortality with lots of infants lost in the first 12 months of life. There were lots of deaths of children in childhood from infectious diseases. And there were far too many deaths of women in childbirth. And the consequence was that the average life expectancy was low and the death rate was high. And then superimposed upon that were the incredible spikes in mortality when the big epidemics came through. So here's 1849, which is an important year in my family's history because our family comes from Ireland. And that was the time of the great Irish migrations to North America during the plague. People from Ireland brought cholera with them on the ships that were known as the coffin ships, where they were packed below decks and shipped across the Atlantic. And in the year of 1849, the death rate from cholera was more than 50 per thousand. In other words, 5% of the city of New York died in 1 year, in that year. In today's terms, with a base population in New York City of about 8 million people, that would be 400,000 deaths in 1 year in New York City. It's the amount of death and disease in this country 150 years ago is almost impossible to imagine looking back from the privileged place we are now in the year 2021, but that's the way it was. And then starting in approximately the 1870s, the death rate began to come way down. Now that's interesting that the inflection point should be in the 1870s because that was about 60 years or 70 years before the invention of penicillin. It was basically a century before the first successful organ transplant. So it clearly was not modern medicine that accounted for this very sharp decline in mortality that occurred starting around 1870. Instead, what it was massive human-made changes in the environment. Basically, what happened was that the leaders of New York City, and the same thing happened in other great cities across North America, the leaders of the city got scared to death, were scared to death of these massive epidemics that came in. And for a few years, they stopped fighting politically. They got together, they formed a grand partnership, they raised the necessary money. They did what had to be done to make the city a safer place. And specifically what they did was they built reservoirs and aqueducts that brought in clean water, and that ended cholera. They built a sewerage system, which took care of the waste, which ended all kinds of enteric diseases. They passed laws and regulations that limited how many people could be packed into a tenement building, that reduced TB. All of those rules, regulations, and bipartisan actions brought about massive environmental change and ended up saving lives. Hopefully it's an image of what is going on in this country today. So this is what happened starting in 1900, when infant mortality was 140 per 1,000, in other words, 14% of all babies. Here we are today where it's less than 5. Without 2000, it's even slightly lower today in this country. And so in the aftermath of the epidemiologic transition, the various non-communicable diseases are going up. Here's asthma, which has tripled. Here's childhood leukemia, which is an interesting story. The mortality from childhood leukemia and other childhood cancers is actually down. And that's because we've gotten very good at treating these diseases. I know when I was a pediatric resident, I trained at Boston Children's, every single child with leukemia died. That was in 1968, 69. No exceptions, they all died. And it was in the 1970s that we got the first 5-year survival. And today, something like 75 or 80% of kids with leukemia survive in the best centers. Of course, the treatment is rough, we've all seen it, but still it keeps the kids alive. But offsetting those gains in mortality is the fact that the incidence, the number of new cases per 1,000 children, has gone up by about 35% in the aggregate since we started keeping national records in the 1970s. Very similar pattern for brain cancer. Survival isn't quite so good, but it's still a lot better than it used to be. But again, the incidence is going up. A third cancer, not exactly of children, but young adults, testicular cancer, has gone up by about 60% since we started tracking it. And at the same time as testicular cancer has been going up, CDC has been keeping records on birth defects of the male reproductive organs in 7 counties around Atlanta, as well as in parts of California and in elsewhere in Georgia. And they have seen something like a doubling in hypospadias and cryptorchidism over this half century. And then there's the problem of neurodevelopmental disabilities, the whole spectrum of disorders of the brain and nervous system, dyslexia, or attention deficit disorder, autism, ASD, and the incidence of those is increasing. You've all seen these sorts of slides on the rising incidence of autism. It's even somewhat greater today. This is 2 or 3 years out of date. You almost have to change it every 12 months. But and some people say, well, it's all better recognition. Well, yeah, I'm sure there is better recognition. There's certainly a lot more societal awareness. And there's probably also some switching of diagnostic classifications, because in some states, including Massachusetts, where I am now, for example, children who are diagnosed with autism or ASD can qualify for certain special benefits. But even though those factors may account for a bit of the switch, there's no question that there's been a real increase in the incidence and a very serious rise in the prevalence of autistic children, whether you define it narrowly or broadly. And it's a sign of that something is clearly going very wrong in the environment. I mean, this is an increase which is just too rapid to be genetic. It can be explained at best only in part by diagnostic change and awareness. There's a real change going on here. The big question is what's going on. And then we have the problem of overweight and obesity. In the 70s, only 5% of American kids were overweight or obese, and today it's actually close to 20%. And we've all seen the consequences: heart disease, diabetes, orthopedic problems, increased risk of cancer, and this demographic consequence, the fear that this current generation of American children could be the first generation of US kids in a century to live shorter lives than their parents. So here's the key question. This is really what brings us together this evening, is to ask yourself, what is the contribution of environmental factors to these rising rates of non-communicable diseases in Americans of all ages? But since I'm a pediatrician, let's focus on children. So one big change in the environment that we now think is not the only driver of this, but an important driver of this change in patterns of disease, is what I call the chemical revolution, the incredible outpouring of new chemicals since really World War II. And today here's a graph showing the increase, and here's showing the global increase. Global chemical production is increasing at a rate of about 3 to 3.5% per year. That translates to a doubling time in global chemical production of about 30 years. So if by 2045 or 2050, somewhere in there, we're going to have twice as many tons of chemicals on the surface of the earth as we have today if we continue on the present trajectory. And here are some statistics. The US EPA lists of about 80,000 chemicals in commerce. The OECD in Europe lists about 120,000. The bottom line is there are many thousands of new chemicals out there that have been produced. Some of them, of course, have been very beneficial: antibiotics, chemotherapeutic agents, disinfectants for drinking water, building materials, motor fuels, all the stuff that holds your computer and my computer together. Those materials we wouldn't have those conveniences today. We wouldn't have the benefits of those products today had it not been for the chemical revolution. The chemical revolution per se is not bad. It's what we've done with it, which is cause for great concern. And what's the real concern is not that they're widely used, but the fact that they've gotten out from their products, and they're now, most of the chemicals that are in commerce today have never been tested for safety or toxicity. So we've used our brains, our ingenuity to come up with this wonderful tool, the chemical revolution, but we've been very poor stewards of this revolution. We have not exercised due diligence. We haven't been prudent. And what we've done is we've pumped out chemicals into the environment, chemicals that now get into all of us because CDC surveys document 200 or 300 chemicals in all of our bodies these days, synthetic chemicals. And this is what typically happens, is that new chemicals are invented and put out with enormous fanfare. Greatest thing since sliced bread. Here's an old National Geographic ad from DuPont going back to the 60s, saying the best things in life come in cellophane. Here's a picture. I wonder if anybody might recognize that. What that is, that's in Jones Beach outside New York City. That's a DDT truck spraying DDT to kill the mosquitoes. And you see the little kids, typically the boys, because they were always more rambunctious, running through the cloud of DDT. I grew up in Boston, and I remember being very angry at my parents who wouldn't let me go out into the street and run behind the DDT truck when they came down every July and August to spray for mosquitoes. In retrospect, I suspect it was a good thing. And then here's another ad saying synthetics, they spell a better life for you. This particular picture is brought to us by Union Carbide. And the problem is that time and again, these chemicals have been brought to market. Chemical engineers have found very interesting uses for them. They've never done any safety checking. They've never done any toxicity testing. And then years or even decades later, chemical after chemical after chemical has been found to harm the environment and cause disease and even death in children. And it's a story that continues to this day. I mean, in the past, we did it with asbestos. We did it with chemicals like DDT, but we're repeating it today with phthalates, with bisphenol A, with brominated flame retardants with PFAS compounds, chemicals that had brilliant uses, made millions of dollars for the companies that produce them, but are now in the environment causing damage. And it's going to take many times the cost of their production to clean up the mess that they've been left behind. We now know that children are far more sensitive to toxic chemicals than adults. And it was a report that came out from the National Academy of Sciences way back in 1993, so almost 30 years ago, which laid out the reasons why children are so much more sensitive to chemicals than adults. And basically comes down to four things. The first is that on a pound for pound basis, children are more heavily exposed to their environment, and therefore they're more heavily exposed to any toxic chemicals that are in the environment. So kids drink 7 times as much water per pound per day, breathe about 4 times as much air, eat 2 or 3 times as much food. They put their hands in their mouths. They just get a lot more stuff into their bodies. Then they're biologically more sensitive because their organ systems are growing and developing, and because their detoxification systems are still immature. They can't break down chemicals and get rid of them. For example, organophosphate pesticides like chlorpyrifos, malathion, when those chemicals get into your body or mine, we can break them down quite quickly. The half-life of malathion in the blood of an adult is about 6 hours. In the blood of a newborn, it's 36 hours. So the chemical has much more time to cause damage to cells. And then, as my good friend Richard Jackson, your former health commissioner, has said, and he was a member of this committee, that children have a long shelf life. They have many more years ahead of them. And since we now know that a lot of non-communicable diseases develop through a series of cellular changes over years and even decades, we now understand that if a child is exposed to toxic chemicals early in life, cellular changes are initiated at that point, that the prospect of future disease is elevated over the risk of an unexposed child. So here was the first terrible tragedy that really brought home to the world, certainly to the world of medicine, the world of regulation, that children are more sensitive to toxic chemicals than adults. And in particular, the thalidomide story brought home the lesson that infants in the womb are exquisitely sensitive because of the fact that their organ systems are still forming through the incredible developmental stages that we all learned about back in embryology. There's lots of opportunity for stuff to go wrong when a system is as complex as is human development. The story on thalidomide, which I suspect most of you know, is that it was a sedative, a very nice sedative, that proved very effective in controlling morning sickness in pregnant women. And so thousands of women took it, especially in Europe and to some extent in Asia. And the upshot was that about 11,000 babies were born with this condition, PHOCOMELIA, that you see illustrated here in this poor little girl, with very withered arms and withered legs. And it turned out that what happened was that the thalidomide interfered with the vascular supply to the developing limbs. And there were some cases where a pregnant woman took the thalidomide just on one day, like a single pill, and like on the 28th day of pregnancy or the 35th day of pregnancy, and the specific lesion that occurred in the baby reflected the very day in which she took the pill. So some children had only the arm defect or only the limb defect. Some children had only the blindness or only the deafness or only the autism, all of which were syndromes that followed thalidomide. So, and the mothers physically unharmed, because they were able to resist the chemical. Their organ systems were fully formed. They were not vulnerable. Here's another classic story here. This one from Japan, what's called Minamata disease. Minamata is a city in southwestern Japan, an industrial city not far from Nagasaki. And there was a chemical factory there during World War II and in the years after the war that was using mercury as a catalyst in the chemical production process. And some of the mercury got loose from the plant, went out through a pipe and got into the nearby bay, Minamata Bay. In the bay, the liquid silvery metallic mercury was converted to a much more toxic form of mercury called methyl mercury, which has the property that it accumulates in the marine food chain. It can reach very high concentrations in predator species of fish that we humans eat. And so when pregnant moms, like this mother here who's bathing her little child in the Japanese hot bath, if pregnant moms ate this mercury contaminated fish during pregnancy, the mothers were physically unharmed, but the mercury passed through and caused this terrible neurological injury that you can see here in the child, the small head, spasticity, profound retardation, terrible, terrible disease. And again, it was an example of how uniquely vulnerable is the infant in the womb to toxic chemicals. So with those several terrible cases as, if you will, excuse the phrase, the poster children for this whole story, it became clear that chemicals in the environment could cause disease in children, and that the very smallest children were the most vulnerable. And building on that recognition, there's been an enormous body of research come out now over the past 25 or 30 years that has identified a whole series of environmental causes for a whole range of environmental diseases. Asthma is probably the most carefully researched of all the environmental diseases in children, and this whole long list of triggers that I list here has been identified for asthma. And there have also been some very good studies showing that reducing these exposures can prevent asthma. In terms of indoor triggers, some very carefully done intervention studies show that getting rid of secondhand smoke, getting rid of mold and mites and cockroach droppings can reduce asthma in children. And then there have been some superb studies done out of USC by the late John Peters and Rob McConnell and Frank Gaudeman and that group at USC, showing that cleaning up the air in the Los Angeles basin has reduced both the prevalence of, reduced the incidence of new cases of childhood asthma in LA, and has also reduced the frequency of asthmatic attacks in children. And there's obviously much work to be done. The air is not as clean yet as it should be, but we have made progress, and children have been the beneficiaries. In the cases of childhood cancer, we know some environmental causes. The diethylstilbestrol story, which is similar to the thalidomide and the Minamata stories. We know about benzene, pesticides, nitrosamine, aspartame. But we really don't yet have a unified explanation for why the incidence of childhood cancer is going up. My suspicion, my hypothesis, is that it's probably synergistic impact of multiple chemicals in the modern environment, and we simply have not been clever enough yet to tease it apart. It's also interesting that there's sort of a yin and a yang here, in that prenatal maternal folic acid and extended breastfeeding are both protective factors. They protect against childhood cancer. They also reduce the incidence of autism and ADHD. What about what's going on with the male reproductive system? Why are sperm counts going down, testicular cancer and hypospadias going up? Probably due, at least in part, to endocrine disrupting chemicals. My friend and colleague, Shauna Swan, who was once in California, she's now at Mount Sinai, New York, has done some pioneering research in this area. She just brought out a book a few months ago in February called Countdown. The title of that book reflects the downward trend in sperm counts in men in this country. And she has been patiently amassing a body of evidence showing that endocrine disrupting chemicals like phthalates, like bisphenol A, probably some others, are at least some of the drivers of this trend. And then we have PFAS, perfluoroalkyl substances, commonly known as Teflon. So it's used in nonstick pans, it's used in Gore-Tex ski wear. It's wonderful stuff. When I was running marathons, I loved my Gore-Tex suit because it kept me warm and dry when I was in Cincinnati and the temperature was 40 below. But when PFAS gets into the environment, it is nasty stuff. It doesn't go away. It's a persistent organic pollutant. It's soluble in drinking water, so it can travel long distances in surface water and groundwater. And we're slowly, meticulously, the epidemiologists are piecing together a coherent picture of PFAS toxicity. So it slows down fetal growth in utero, leading to small predates babies with decreased birth weight. It seems to increase the risk of ADHD. It has kidney and liver toxicity, pushes up serum lipid levels, thyroid disease. Philippe Grandjean, who oscillates between Denmark and Harvard, has shown that children with high levels of PFAS have diminished immune function, and that blunts their ability to form antibodies after vaccinations, very relevant today, and decreased fertility. So another endocrine disruptor. The human brain is exquisitely sensitive to toxic chemicals. I mean, we all learned back in embryology how complex is human brain development, going from a few cells on the dorsal surface of the embryo to an organ with several million cells and billions of precisely engineered connections, and all of that formed pretty much within 9 months. But that complexity brings with it enormous vulnerability. And we now know that because the brain has very limited capacity to repair itself, that brain damage done in infancy can be permanent and irreversible. And it all reflects the brain's complexity. And there are various specific brain syndromes that have been researched in enormous depth, probably most among them childhood lead poisoning. So lead, up until the early 1900s, lead was an occupational disease, and basically that's all it was. But what happened a century and a quarter ago was that mechanized mining was developed, and all of a sudden it was possible to pull much, much greater quantities of lead out of the earth than ever before. So the lead industry had to come up with products for this stuff. And one of those products was lead paint. They started selling it, and then kids started getting into it, and lead poisoning resulted. It was one of the early examples of a chemical being developed, put on the market with no consideration of what might be the downstream consequences. And the first kids were children who showed up with coma and convulsions at the hospital in Queensland, Australia. And it was first thought that maybe they had some kind of a tropical encephalitis, but the absence of fever argued against that. And finally, two physicians down there, Drs. Gibson and Turner, did the necessary shoe leather epidemiology and realized that these children had gotten into paint chips on their painted porches. And then 50 years later, in the 1940s and 50s at Harvard Medical School, Randy Byers did some early studies that brought home to the pediatric community the fact that lead wasn't just an acute disease that might cause a child to die, but that it also had lasting sequelae. And the clinical observation that triggered that was that the Boston police brought a kid into the emergency room, 9-year-old boy, who had tried to stab his teacher with a pair of scissors. And the nurses in the ER called Dr. Byers down because they saw his name in the chart. He had treated the child for lead poisoning when the child was 2 years old. And so Randy came down and he spoke to the mom, and he learned from the mother that this child had been a sweet, gentle little boy until after he had his bout of lead poisoning, from which he obviously recovered. But ever since then, he was short-tempered, aggressive, quick to anger, and the stabbing episode was just a manifestation of that. So Byers was a clever guy. He set up a small epidemiologic study with Edith Lord, who was his social worker colleague. They looked up 20 children whom they had treated, and they found that 19 of the 20, 95%, had persistent problems. And so that broke the dogma, and it opened up the understanding that lead had a much more complex toxicity profile than before. Then along came this man who was a dear friend, Herb Needleman, who did classic studies showing that children in the greater Boston area who were exposed to lead paint and dust from the erosion of lead paint had reduced IQ. I won't go into the details of the study for time reasons, but he did these very meticulous analyses, and he found that children with higher levels of lead in their bodies had on the average 7 or 8 points lower IQ than children of the same ethnic backgrounds, same racial groups, same socioeconomic status, same medical histories, who were not exposed to lead. And that basically opened up the whole concept of what is called subclinical lead poisoning, or I prefer the term silent lead poisoning. The notion that even low levels of exposure can cause damage, that there's a spectrum of toxicity that ranges from high to low. And it's not just lead. We now know that it's lots of chemicals that have the same spectrum of toxicity. Mercury does, solvents do. And when a whole society is exposed to a neurotoxic chemical like lead, like mercury, like pesticides, you have a reduction in the average IQ of perhaps 5 points or 7 points. But when you compare this group of children, this is a population not exposed to a toxic chemical. This is a population exposed. You see the average IQ goes down from 100 to 95, which seems kind of trivial on a 200-point scale. But the action's not in the middle. The action's at the extremes of the curve. And you can see that the number of really gifted children is reduced by more than 50%. And at the same time, the number of children with cognitive problems more than doubles. And when you apply that calculus to an entire society, the impacts are massive. The impacts on the educational system, on the healthcare system, the economic impacts, even the impacts on the criminal justice system. And it's not just intelligence, it's delinquency, school problems, dyslexia, school dropout, and higher risk of incarceration. All of that was established through a series of elegant, long-term, 10, 20-year follow-up epidemiologic studies. And we now have this list of 15 or so chemicals, and there's actually probably a couple we should be adding now in the last 2 or 3 years, that chemicals where early life exposure causes brain injury that manifests as loss of IQ and behavioral problems. And I think of this as being like an iceberg. You have this small number of chemicals, 12, 15, 20, something like that at the very top, that we have really studied very carefully, where we have defined the developmental neurotoxicity. And then we have a couple of hundred more chemicals here that we know from occupational studies or experimental studies are toxic to the brain, but we haven't done studies yet in young children. And then finally, we have this huge universe of manufactured chemicals, so many of which are in our bodies, and we simply don't have a clue what they might be doing to the developing brain. This is a very worrisome situation. This is the consequence of the careless, reckless, short-sighted pumping out of thousands of chemicals into the environment over the past half-century. Oops, sorry, wrong direction. But there's good news. At the end of the day, after all this gloom and doom I've been putting out there, I want to leave you with the message that disease in children caused by toxic chemicals can be prevented. After all, it's human behavior that put these chemicals out into the environment and got them into kids. And so theoretically, at least, by modifying that behavior, we can prevent exposure. And the two keys to achieving such behavioral modification are, first of all, scientific discovery, learning that a chemical causes heart hazard. And secondly, having the courage and the will to accept the truth and act on it and not ignore the science. We just in the last year, we've seen the terrible, terrible consequences of willful ignorance of science. And we can't make that mistake when it comes to toxic chemicals that can cause lasting damage to children. So here's the classic case. This is the story of the removal of lead from gasoline, and Herb Needleman and I and others were involved in this. So in 1975, we were putting about 100,000 tons of lead into the gasoline supply in the United States every year to improve engine performance in cars, so cars could run faster and run smoother. And at that time, the lead that went into the cars came out in the exhaust, contaminated the environment. The average blood lead level in American children back then was close to 20 micrograms. Those of us who do pediatrics know that when a child comes into the ER today with a blood level of 20, red lights go off, bells start to ring. But in those days, any blood level below 40 was considered normal because nobody got into convulsions below 40. So that was the definition of lead poisoning. And 20 was accepted as that's just the way it was. But in the mid-70s, with the work that we were doing on subclinical lead poisoning, the data were accumulating that low levels of lead were causing intellectual damage to children, we finally persuaded EPA to do the right thing and take lead out of gasoline, which they did in a stepwise, phased out fashion over the span of some years. And you can see here from 1975, when they started the removal of lead, through 1980, the total amount of lead fell from 100,000 tons to about 40,000 tons. And it was predicted that blood lead levels in American kids would come down just a little bit, maybe a microgram or two, in consequence of that. But in fact, this is what happened. Here's the blood lead levels over here. This is the mean blood lead levels for the entire population. Children tend to be a bit higher, closer to 20. And you can see it came down almost in perfect parallel with the reduction in the use of gasoline, and it's continued to come down today. And the average blood level in American children today is something like 1.2 or 1.3 micrograms. And so what are the consequences of this one action, this one evidence-based, courageous public health action, getting lead out of gasoline, and at the same time taking it out of new paint? So we achieved a 95%, more than 95% reduction in blood lead levels, huge reduction in the incidence of acute clinical lead poisoning. It's almost never seen anymore except in very rare circumstances. We reckon that we pushed up the intelligence of the whole American population by at least 2 points, and probably by as much as 5 to 7 points, which I always say is why my grandchildren are way better on the computer than I am, because they grew up in a mostly lead-free environment. And that increase in intelligence translates into greater creativity, which in turn translates into greater economic productivity in the population. And so we reckon that in each annual cohort of babies born since 1980, they have put about $200 billion back into the American economy. And since more than 40 years have passed since that time, you can multiply that annual increment of 200 billion by 40, you'll get a figure of $8 trillion, which seems almost mind-boggling. But by straight mathematics, that has been the economic benefit of the United States of America of taking lead out of gasoline, which just goes to show you that good evidence-based public health pays off. And then one final benefit of that action of removing lead from gasoline is that 20 years later, lagged by 20 years, there was this incredible fall in the murder rate across the USA and in other countries around the world that have done the same kind of broad-scale epidemiologic analysis. And not just murder, but other violent crimes as well have come down. So at the end of the day, my summation is, number one, children today live in a world surrounded by way too many untested chemicals, and far too many of these untested chemicals have proven to be toxic years and even decades after they got onto the market. We have to do better than we are in regulating chemicals in this country. There's need for a massive revision of the national chemical policy. And at the end of the day, we know that if we do have a logical policy in place, if we do confront vested interests who are making billions of dollars, making and disseminating toxic chemicals into the environment, we can improve children's lives. So with that, I'll stop and give it back to you, Cindy, and to Gina Solomon, and I'll stop sharing my screen. Thank you.
Great. Wow. Thank you so much, Dr. Landrigan. That was an amazing and inspiring talk, and it really highlights the depth and breadth, as well as the history of children's environmental health, as well as the need for policy to prevent disease. And we're going to talk about that a bit in Q&A, I'm sure. I just want to say you just have this amazing ability to present this really concerning and complex material very clearly. And I want to thank you for all you've done to educate the next generation of leaders in public health. Your work has really been critical, and we all appreciate it. All right, so now it's my distinct pleasure to introduce Dr. Gina Solomon. She's another highly respected physician and scientist who's working on children's environmental health for many years. Dr. Solomon is a principal investigator at the Public Health Institute in Oakland, California, and a clinical professor in the Division of Occupational and Environmental Medicine at the University of California, San Francisco. She served under Governor Brown as a deputy secretary for science and health at the California Environmental Protection Agency. And she's served on multiple boards and committees of the National Academies of Science, US EPA, and other federal and state agencies. She's a former senior scientist at the Natural Resources Defense Council, and she researches science and policy issues related to toxic chemicals and environmental health. Her current work focuses in socioeconomically disadvantaged communities and areas with high rates of breast cancer. She also works to protect public health from toxic chemicals in consumer products and pesticides. Dr. Solomon leads the Achieving Resilient Communities project, engaging and empowering California communities to strengthen health despite a changing climate. Thank you so much, Dr. Solomon.
Thanks, Cindy. And thank you, Phil. That was a wonderful talk and an amazing summary of decades of really amazing work in the field of environmental health that's protected many, many children. I'm not going to use slides, and my talk is relatively brief because I do want to get to the Q&A. I'm going to go a little off script here. Phil talked about childhood leukemia early on and showed some of the, showed the trends in that disease, and talked about how back in the 50s and 60s, every child died. And unfortunately, my brother was one of those children. He passed away of leukemia before I was born. And that was all, I think, part of the reason that I always, that got interested in the field of environmental health. And one of the things that I learned many, many years later, as a little case study, as my parents were talking about the landlord that they had back in that time, and that he was really scrupulous about trying to take good care of the apartments. This was in New York City. And so he would send people in every couple of years to repaint. And they would come in and paint the whole, scrape the paint and paint the place. And my brother Mitchell loved to hang out with the painters and would get splattered and covered with paint. And then the painter, who had a thick accent, would say, got to wash him off with benzene, and would slather paint remover all over him to clean him off. Well, we now know that benzene is a known human carcinogen that causes leukemia. Is that what happened? Was that the cause? Well, one of the things about environmental health that makes it really tough in the clinical world is that the cause and effect is often difficult to ascertain. You can do it through epidemiologic research and statistically, but for individual cases or patients, it can be very difficult to say, yes, this was caused by an environmental exposure, or no, this was not caused by an environmental exposure. It's tough, in contrast to some of the diseases that Dr. Landrigan showed early on, cholera, smallpox, those kind of knew what it was, what caused it. Especially now we know, but as time moves on, there are ever more chemicals emerging and being used in a very widespread way in our environment and even in products that we have in our homes. And the science is always behind. The products are not required to be tested before they come onto the market. They end up, where kids can be exposed to them. And then, many, many years or over the course of decades, and in fact, the toxicology research, the epidemiologic studies that Dr. Landrigan described, those are painstakingly done and published and replicated, and are subject to meta-analyses and systematic reviews and all kinds of debate, and ultimately can result in action that protects people and public health. And we have a great history of solutions and successes. Benzene isn't out there nearly as much as it used to be, nor is lead. But none of these legacy contaminants have completely gone away. In fact, one of the areas that I'm working in right now has to do with health effects in areas affected by the California wildfires. Many of you may remember in November 2018, the Camp Fire that destroyed the town of Paradise, California, up in Butte County, destroyed a number of nearby areas, incredible devastation, about 12 to 13,000 structures, homes mostly destroyed in the fire. But there were many homes that were not destroyed in that area. In fact, about 1,200 homes were not destroyed, and people began going back to those homes, especially because their insurance companies wouldn't pay for hotels if their homes were still standing. Some of those people had kids, and those homes turned out to have a problem that wasn't apparent immediately, which was that the water was contaminated with benzene, the same chemical that what used to be in paint, used to be in high concentrations in gasoline. And it was really strange. Why did the water smell like petroleum when people turned on their tap? And where did the benzene come from? It was a mystery that required quite a bit of unraveling. It actually turned out that the first time this cropped up was in 2017 after the Tubbs fire, but it was just in 13 homes. Sorry about the dog. In 13 homes in that in an area called Fountain Grove that had been mostly destroyed. So it didn't get a lot of attention at that time, but in 1,200 homes, it made a big difference and got a lot of attention. People couldn't drink the water, they couldn't bathe, they couldn't use it for cooking, and it created this incredible stress that added to the many, many stresses that people in that community had faced. We and many others did analyses, went up there, did a lot of water testing, and found that the issue seemed to be that many pipes nowadays are made of plastic, PVC or polyvinyl chloride or other types of plastics. Those pipes melted or even burned from the heat of the fire. The other thing that happened was that all of the plastics inside people's homes, and if you look around yourself, there's a lot of plastic-based material in all of our homes. And so it wasn't just wood smoke that was being created in that fire, it was a lot of combustion of plastics. And when those burn at high temperatures, they break down to the simplest building block, which is benzene. And that smoke was sucked backwards into the water system because the water system depressurized during the fire. And when a water system, normally water system is positive pressure, but when all the water leaks out because of a million holes in the system and all the firefighting efforts, and the pressure zeroes out, it becomes a big, sucking force. And that's contaminated smoke ended up deep within the pipes of the water system, adhered to the pipes, and then was gradually re-released into the water when the water came back online. Crazy problem, and yet another thing that threatens health, and that was a curveball thrown at us really by climate change, because that's what's causing ultimately our huge wildfires here in California. We now are facing we're in the driest year in the last 140 years. We're in many counties are in drought emergencies. Those who aren't will soon be in drought emergencies. And we're looking at a significant wildfire season bearing down at us very soon. And these issues too have huge and disproportionate threats to children's health. Children, as Dr. Landrigan pointed out, they breathe more air per pound of body weight. So if the air is full of smoke, they are breathing a lot more of it. Their lungs are still developing. And in fact, studies in children that are growing up in different parts of California, more polluted versus less polluted, with the more polluted being certain areas of Los Angeles in these studies, found that children's lungs just did not grow and develop on the same healthy trajectory as kids growing up and breathing cleaner air. But now with the broad wildfire smoke events, that may be all of our kids. And then in areas that are affected with wildfires, we have to worry about water quality, we now know. And we also have to worry about population displacement, anxiety and stress piled on top of the anxiety and stress created by the COVID pandemic. And these are all things that also should be avoidable and that could be avoidable. Taking steps to ramp up community preparedness and to really cut back greenhouse gases could still avert the worst effects of climate change. And we're seeing a lot of changes on the policy front. Cindy had wanted me to talk a little bit about policy, so I'll just mention that before wrapping up. There are a lot of things that are going on right now that are, I think, really trying to grapple with these issues. Efforts to really do a better job with the amendments to the Toxic Substances Control Act that were passed in the waning days of the Obama administration. That are now being implemented in a more aggressive way. Main thing there is that chemicals that are coming newly onto the market will get much more scrutiny than they did in the past to be sure that they're not only safe for adults, but also safe for kids' health. And I certainly hope that will happen. It's to be determined still, but things are looking better. There are many chemicals that are on the market that have just been sort of lingering, that are where the science is really quite clear that they are not safe to be in environments where kids may be exposed to them. And the U.S. Environmental Protection Agency is now taking steps to address some of these. Then here in California, the governor's budget that was just announced a few days ago has actually enormous investment for community resilience to help build up and prepare communities to deal with the health effects of climate change and not be crushed by them. And we're going to need all of that money and help to deal with drought, wildfires, and when the problem with climate change, of course, is it causes the weather pendulum to oscillate in an insane way. And so what we're going to see after some years of drought is very likely, unfortunately, some flooding in the future. And so we're going to have to deal with all of those extremes and make sure that kids will bear the brunt of all of these environmental disasters. You know, that that there are focused efforts in place to make sure that they're protected and their health is, and both physical and mental health are addressed into the future. So I'm actually again, despite the depressing content of these talks, I actually just like Phil Landrigan, I'm optimistic that we will see, we'll get through this, and you know, kids and families are resilient, and I think we can, with good policy, you know, make our way through this and do well. So I'd love to turn to questions though, because I know that Cindy, you have things to ask, and there may be others on the phone and on Zoom that do as well.
Great. Well, thank you so much, Gina. That was great. That extemporaneous talk about all the things you're doing. And I think we could go on for a long time. You have such expertise in so many things. Thank you. And that was just such a very clear explanation of what happened from the wildfires in the water. You know, it's amazing. It's just another unintended consequence of all the things. It's one thing that leads to another. And so important, all the work you're doing, both of you. So we're going to go ahead and we're going to start the Q&A now. The first question is going to be for Dr. Landrigan. And do you think that chemical exposures are contributing to autism? And if so, what are the top chemicals or metals that may be most strongly implicated in autism?
Yeah, well, thank you, Cindy. So I think chemicals are contributing to autism. The first reason for saying so is sort of negative reasoning, the fact that the rate of increase of autism has been so great, it just can't possibly be genetic change. I mean, genetics change just takes generations to play out. You don't get the kind of increase that we've seen in 30 or 40 years from genetic change. And it's not diagnostic recognition, at least most of it isn't. So something in the environment is causing it. And I think chemicals are at least part of the story. And in fact, there have now been a series of chemicals that have been linked to autistic behaviors in children. I don't have a complete list in front of me, but a partial list. It includes lead. It includes traffic-related air pollution. Studies done in Southern California have shown that women who are pregnant in corridors along major highways where they're exposed to traffic-related air pollution are more likely than women of the same ethnic backgrounds who live further away from the roadways to give birth to autistic children. Some of the neurotoxic chemicals that I showed on that pyramid slide a few minutes ago have been linked to autism, and I have no doubt that there'll be more in the future.
Okay, thank you. We have a question here from Dr. Gould. He wants to thank you so much for your presentations and thoughtful comments, and he wanted to get your perspective on the state of the EPA in the wake of the devastating experience during our last administration. And at UCSF, our program on reproductive health and environment utilized our science response network to engage health professionals to push EPA to advance their scientific methods, better protect communities and workers from a variety of toxic substances for which protections have been absent to minimal, and for which we are honestly always catching up with new concerns about population impacts. So I'd like your opinion on the viability of pushing EPA and other agencies at this time. Thank you, Dr. Gould.
Is that for Gina or me?
We can do both. Gina, do you want to start?
Sure, and
I think it's for
just want
both.
to, yeah, I want to thank Dr. Gould for mentioning the UCSF program on reproductive health and environment and the UCSF Earth Center. They're doing fantastic work and have been really bird dogging EPA and EPA's policy efforts and pushing when the EPA, I'm sorry to say, was essentially unpushable under the previous administration. There was leadership there that was not responsive to science or facts or logic. But the thing about pushing even during that darkest of time is that it creates a record that, the public comments that were submitted by the UCSF team and by the other scientists on all of the really, inadvised rulemaking efforts have already been extremely successful and will continue to be successful at reversing those the damage done and correcting correcting the science and correcting the policy as a result. So it is important for physicians, health professionals, scientists to make their voices heard, to get the actual facts into the record, even during a time when it seems like nobody actually is going to read what you write, because eventually someone will.
Yeah, that's good. Dr. Landrigan, do you have some? Thank you, Dr. Solomon. Dr. Landrigan?
Yeah, first of all, I totally agree with what Gina said. It is so important for doctors and nurses and other health professionals to speak up on these environmental issues, because we remain very trusted voices in a complex society where lots of other professions are not so trusted anymore. And when we speak up, when we array the evidence and speak with a clear voice and confront power with truth, we can make enormous change. I was involved with a group who published a big report that just came out in February in The Lancet, where we tried to tabulate all the damages to the health of Americans that took place during the 4 years of the Trump administration. And I sent that report and an infographic that the Lancet people had developed. I sent it to both Gina and you, Cindy, as Gina was talking. So please feel free to pump it out to the 23 folks who are part of the seminar, part of this webinar. And we tried to tabulate all of those. And my particular job, the team that I was on, was to look at the environmental and the occupational rollbacks. And it's a good news, bad news story. The bad news is that the Trump administration tried to roll back more than 100 occupational and environmental regulations. And we know from looking at national data that those rollbacks caused disease and they caused death. We saw increases in deaths from ambient air pollution during those 4 years. Air pollution deaths have been coming down in the United States for 50 years. Since the passage of the Clean Air Act in 1970, had come down by something like 70% over that span of time. And in the 4 years of the Trump administration, they went up. Nothing like the way they used to be, but still they went up. And we reckon that about 20 to 25,000 people lost their lives from heart disease, stroke, and lung disease, principally as a result of that. There was also an increase in deaths from injuries and illnesses in high-risk workers, especially underground miners. Fortunately, many of the rollbacks that the Trump administration proposed were stopped in the courts, so they never went into law. Some of them did, but most of them were stopped, thanks to NRDC and other groups who stood up to the administration. And consequently, most of the rollbacks were achieved solely through executive order. And the nice thing about an executive order is when the government comes under new management, as happened in January of this year, executive orders can be quickly undone. You don't have to go back to Congress. You don't have to pass a new law. You can simply undo the executive order and begin to right the ship and point it in the right direction. Can't be done overnight because unfortunately the agency's lost some good people who just got discouraged and departed, and institutional memory was lost, but at least we're moving in the right direction. And I think with the current national leadership has been very visionary in the way they're approaching it. And then there was one more lesson that came out of all that, and that was the lesson of how powerful the states are as laboratories of democracy. California was a leader in this, Massachusetts, New York. States with strong state government, with a strong sense that places where there's a strong sense that government should actually intervene to make people's lives better, did an extraordinary job in holding up the flag during the time when the national leadership was absent. And that's a lesson we all have to remember for the future, because whatever goes around comes around, and sooner or later there's going to be an administration back in Washington that's hostile to the environment, hostile to public health. And once again, the states are going to have to step up and fill the gap.
All right, thank you. That was wonderful. Here's another question. Do you see a place for whole food nutrition campaigns on the part of the medical community to reduce intake of chemicals in our manufactured food and to support a healthy immune system? And happy to have this answered. We're going to talk a lot about this at the next seminar also in June 3rd. So whoever wants to start. Do you want to start, Gina?
Yeah, so Dr. Shetler, who's speaking at the next session, will be well positioned to answer all the different dimensions in that question. But yes, diet is incredibly important. And it's important in multiple ways. I mean, it's important in terms of the intake of the nutritional intake, the intake also of chemicals, and even perhaps in other ways in terms of the effect on the microbiome, which may in turn relate to the health of the brain, as we've discovered, and may relate to that first question on autism. So it's a complicated question. I definitely focus on diet and recommend that people eat a very healthy diet, that they, it's the same recommendations that physicians give their patients all the time. Lots of fruits and vegetables and whole grains, a lot less meat. Many people don't realize that also reducing consumption of meat, or especially beef, also reduces your climate footprint enormously, because beef create enormous amounts of greenhouse gases, or cattle do. And I think eating organic is always the best choice if you can get it, or transitional organic. I eat organic partly not necessarily for myself, but also for the farm workers and their families that are producing the food, and the people who live next to the fields, because I've been to those communities and I've stood next to those fields, and I've seen how close the homes are, and the kids that are playing in those yards are to where the pesticides are sprayed. And it's not okay. And so by supporting organic or integrated pest management or transitional organic, you're making a difference, not just for your own family, but for many other families that are that really need a safe place to live.
Great. And Dr. Landrigan, do you want to comment on that?
There's really nothing. I agree completely, and I think Ted Shetler at your next seminar is going to be able to amplify enormously upon that topic.
And there is another question that came up Bernadette Fraser. She's a retired pediatric oncology RN, and she wondered what a good source for learning about geographic clusters of pediatric cancers are. And I guess it's a related comment about immigrant farm workers and the incidence of pediatric cancers in their children. I don't know if anybody has a comment about that.
Gina, you probably know the California databases way better than I do.
California has a cancer registry. You can actually go to it at ccrcal.org. And they have some useful data on there. You can also, as a member of the public or as a health professional, you can request an analysis from the California Cancer Registry if you suspect a cancer cluster in a given area. But have to caution this, as with many things in public health, the cancer registry is woefully underfunded. They are behind, so they actually do a very good job capturing cancer data, but they do it, several years too late. So we don't have up-to-date data, and then because of obviously concerns about privacy, you usually can't get very detailed geographic resolutions. So it can give you some information, but it's tricky. Cancer clusters in general are tricky. It's many of us who have worked in environmental health for a long time have been burned by cancer clusters just because many of the investigations end up being inconclusive. It's very difficult with small numbers to really clearly identify a smoking gun. And the problem then is that it's frustrating for the community and for the researchers, and doesn't mean that there's not an environmental cause, but just that it was very difficult to statistically prove it. In farm worker communities, there have been a number of childhood cancer clusters going back many decades, mostly in the 1980s in McFarland and nearby communities. Those were investigated, and unfortunately, there were high suspicions that they were associated with pesticide exposures, but it was difficult to prove. I'm not aware of any current cancer clusters or big elevations in childhood cancer rates in farm worker communities, but I do happen to know that pesticides that, especially agricultural fumigants, one called 1,3-dichloropropene or Telone, that's a carcinogen, is widely used in enormous quantities in parts of the Central Valley and a few other areas of California. And so, there are carcinogens being used. It's hard to imagine that, I hope that kids aren't being exposed to them and getting sick. I worry about that.
All right, thank you, Dr. Solomon. Here's a question for Dr. Landrigan and Dr. Solomon. What is your advice on the best reference for pediatricians on this subject of environmental health? Dr. Landrigan?
Probably there's two. One is the American Academy of Pediatrics Green Book, which is now, if memory serves me correctly, in its 4th edition. The AAP updates it about every 4 or 5 years. They have a crackerjack team of usually a mix of senior and junior pediatricians from all across the country. AAP members write the chapter under the direction of 2 pediatricians, Sophie Balk and Ruth Etzel, and it's a great reference. There's a textbook that Ruth Etzel and I wrote called Children's Environmental Health, Oxford University Press. We use it in teaching some courses. I think if you're a practicing pediatrician and you need to reach for the information quickly, you want the Green Book. It was designed to be the counterpart to the Red Book.
Okay, Perfect. Great. All right. Here's another question for both Dr. Landrigan and Dr. Solomon. Industry influence in science is common. David Michaels wrote a book called Doubt is Their Product. In it, a tobacco industry executive memo stated, doubt is our product since it's the best means of competing with the body of fact that exists in the minds of the general public. It's also the means of establishing a controversy. So maybe Dr. Landrigan first, have you seen this type of influence and how would you suggest combating it to reveal the facts to the public?
Yeah, unfortunately, that kind of influence is all too real. And both Gina and I know David Michaels personally. He was the head of OSHA for almost 8 years during the Obama administration. And he was actually at a memorial service that we attended earlier today. So the strategy of manufacturing doubt is something that was originated in the 50s and 60s by the PR firms that work for the tobacco industry. And rather than flatly denying the epidemiology when good studies were done that linked tobacco smoking to lung cancer, rather than frankly denying it, they said, well, you know, maybe it's something else. Maybe the people that smoke were destined to get lung cancer. How do you know that that's not true? It's kind of hard to prove that. And they created, pardon the pun, but a smokescreen that to basically try to obscure the epidemiologic data. It was only after 10 or 20 years when the epidemiologic data had the evidence continued to build and the evidence was so strong that only a blind person could ignore it, that finally it became generally accepted that smoking caused lung cancer. But it took literally decades to get there. And in the years since that time, other industries saw how effective the strategy was for protecting markets. And so the asbestos industry, the pesticide industry, the manufacturers of all the different chemicals we've been talking about tonight have all adopted these strategies. And in fact, many of them are using the same PR firms as the tobacco industry is. It's really awful. And they have several layers of strategy, several layers of attack that they use. One is to create doubt. Another one is to try to, when they think they can get away with it, is to go after the scientists who do the research and try to smear them as individuals, even to the extent of sticking private detectives on them in some cases. And then as they become more sophisticated, they have found that they can, from time to time, entice a scientist to go over to their side, to take very large sums of money, often 6 or 7 figure fees for the senior people, and do very sophisticated studies that never quite find anything, and always come up with a hint of a finding, but then say, well, it's due to the fact that the people behaved badly. They ate too much, they smoked too much, they drank too much, they came from the wrong part of the tracks. And there's this whole industry now out there of what's been called junk science, people who manufacture these fabricated reports, some of them ghost written by publicists, and then the scientists put their name on them. And there's several books that describe it very, very carefully. David Michaels' book is one. There's another one by Naomi Orestes called Merchants of Doubt. There's a recent book by an investigative reporter named Carrie Gillum, which is called The Monsanto Papers. It focuses on Monsanto's dirty tricks around the herbicide glyphosate. It's a sorry story, and part of the reason that it goes on and is so prevalent is a direct consequence of the Citizens United decision that the Supreme Court handed down a few years ago, which allows corporations to funnel enormous amounts of money into political donations. And so the chemical and pesticide industries are pumping millions and millions of dollars into congressional and senatorial and gubernatorial and even presidential campaigns to try to support candidates of either party. It tends to be more one than the other, but still they'll take people from either party who support their point of view and fund them lavishly. Another book you might want to read if you're interested in the political ecology of this, Senator Sheldon Whitehouse from the state of Rhode Island has written a book called Captured, which elaborates upon how the so-called dark money buys politicians.
Great. Great. Any other additions there, Dr. Solomon?
I'd just like to point people who are interested in this topic to the UCSF Industry Documents Archive. The UCSF Library has been the happy recipient of literally millions of pages of previously secret documents from the tobacco industry, the chemical industry, the drug industry, the food industry, the fossil fuel industry. These documents are available for anyone to look at. They're posted on the library website under industry documents.ucsf.edu. You don't have to log in or anything, and you can peruse them yourself if you want to and do research on them. You can do sophisticated searches. So that's a fun resource if anybody wants to pursue this further.
We can put that maybe in our resource list we'll send afterwards. That'd be great. We'll get the link from you, Gina. That'd be great. We're going to go through a little bit more. If people would like to just stay on for just a few more questions. We have, some of these are sort of similar kind of questions, but President Biden signed a memorandum that prevents political appointees from interfering with the work of career federal scientists. Will this measure help in the area of protecting children from environmental toxins? And if not, what other measures do you think need to be taken to reduce exposure to toxins? I mean, if there's any other comments that you have and what you thought about that memo.
I think the memo is a good thing. We saw some very unfortunate episodes of political interference with science in the last administration, most obviously at CDC, but also at EPA and other places. And there's an old saying, what happens when you mix science and politics? And the answer is politics. So I think that memo is good. It's going to be hard to enforce, but it's good, and it gives whistleblowers and other people a lever to push back if they feel that improper influence is going on. I mean, sometimes the line between suggestion and order is a little hard to disentangle. It's not always black and white, but still, the memo is a good thing. The broader question is, what do we need in this country? What we need in this country is a fundamental reset of chemical policy. The current situation is that chemicals are presumed innocent when they come onto the market. If DuPont or Dow or Monsanto or any of the big chemical companies invents a new molecule and finds a use for it, a commercial use in a plastic or in some product, and wants to put the thing on the market, all they have to do is send a memo to EPA informing EPA that this molecule is coming onto the market next month, and EPA says, great. And that's just not right. I mean, chemicals have more rights under the law than most Americans, certainly much more than Black Americans or brown Americans. And it takes years upon years of research to prove that a chemical causes harm to get it taken off the market. We first passed chemical safety legislation in this country in 1976, something called the Toxic Substances Control Act. In all those years, since 1976, the total number of chemicals that have been removed from the market because of toxicity is 5. And in that same time, something like 35 or 40,000 new chemicals have come onto the market without testing. I mean, there's something fundamentally wrong with that picture. Now, actually, in the waning months of the Obama administration, Republicans and Democrats in the Congress got together and they passed something called the Senator Frank R. Lautenberg Chemical Safety Act for the 21st century, which has 2 very important provisions. Number one, that new chemicals have to be proven safe before they come to market. And number 2, that EPA has to establish a list, starting with the worst first, identify a list of 10 chemicals and act expeditiously on those 10 chemicals to decide what to do about them. Needless to say, that legislation went up on the shelf and stayed there after January 2017, but the law is still on the books. The law was not undone in any way. And I'm cautiously optimistic that the Biden administration will now take this strong framework, which is very much needed, which ultimately is all about protecting America's kids, whether they're in red states or blue states. And I hope they act on it. I sincerely hope they do, because we badly need it. We can't continue down the road we are.
Yeah, thank you. That was well said. Gina, I have a question for you. What happens, and Dr. Landrigan also, what happens when you have things that aren't listed as a chemical? So you have nanoparticles. I mean, they're in that gray zone. They're not a chemical. What kind of an exposure are they? And to my knowledge, there's not even been any legislation. I think President Obama had some legislation to start looking at it, but I mean, they're known to be toxic. I know UC San Francisco's done work on this. And I'm just wondering what, they're in a lot of products now. They're in a lot of consumer products now. And it's an issue for wastewater treatment plants as well, because they're trying to remove the nanoparticles. Do you have any comments about that?
Yeah, nano is an interesting topic. There are intentionally produced nanomaterials. There are also a lot of unintentionally produced nanomaterials out there. Turns out, in fact, one area that has been getting some attention quite a bit in the European Union and to some degree here in the US is micro and nanoplastics. Turns out that if you actually take dust samples in most people's homes, there are microscopic and even nanoscale particles of polypropylene and polyethylene and even synthetic rubber, which is a plastic, in that dust that kids can crawl around on the carpet and get on their hands and end up getting their mouths, or they can, get that, breathe it in. When, I don't want to totally freak out about it, but, it's turning out that as we reduce exhaust emissions through regulations in California from vehicles, that tiny plastic particles from tire wear and particles from people's brakes when they hit the brakes that are often nano-sized are ending up in the urban air as a significant component. Problem with nano particles is they're very difficult to measure. And so the techniques in the real world, in the laboratory, yes, but in the real world, the techniques to measure them have been rolling out relatively recently. But now I'm happy to say, for example, the Bay Area Air Quality Management District now has monitors looking for nano-sized particles in the air around the Bay Area. And there, once you can measure something, you can start to get a little bit better about how do you control it. And so that's sort of where things have been going. I think there have been some efforts, and a lot of research into this issue, but it's still one of those things that needs a lot more attention.
Yeah. Thank you, Dr. Solomon. Here's another question from Dr. Jackson. You've been focused on the harm caused by chemicals. Do you consider electromagnetic radiation fields to be environmental contaminants and dangers, especially to children, and seeming runaway threat that it poses? Again, it's a seemingly overwhelming power of industry that will be challenging to overcome. There's growing science demonstrating harm from EMR, such as that generated by wireless technology, and children are major targets by industry. Does anybody have any comments about that?
No.
No, okay. Yeah, I think that there is definitely science that is definitely out there on it, and the science is really growing on it. I mean, I personally have looked into this, and I think it's a real concern. So important for other people to really look at it, including the NTP and all their work on cell phones and brain cancer, and Chris Portier and his work on it. Certainly it's a huge concern for children and
Yeah,
something
and
that needs to
there
be
are
done.
big studies going on at the
Big studies.
Ramsini Institute in Italy that may
Ramsini's done the studies, exactly,
clarify some of these issues, yeah.
exactly, even at levels that are considered currently safe. So there are a lot of science on that. So thank you for the question.
Yeah,
What about-
and I agree. It's an important issue, and I think it makes sense to well, I guess kids don't talk on the phone anymore. They text or do social media. Maybe that's a good thing.
Yeah.
Because so much of the issue with these electromagnetic fields has to do with proximity, and so
Having
and a lot of
Well, and now we have
Yeah,
earbuds,
you know.
earbuds that are, in the ears all the time, and they'd only turn off when you put them in a little box. So the wireless ones, so that's a concern. All right, another question here. What are your thoughts on genetically modified foods? Speaking of environmental contaminants, is sort of questionably listed.
I can say something about that.
comments?
So,
Mhm.
I don't think there's anything wrong per se with taking a gene and sticking it into corn or soybeans or some other food crop, because new genes are moving in and out of plants all the time, little pieces of DNA. And there's no reason to think that this or that piece of DNA in an ear of corn is going to be harmful to a person. But the problem is that it goes way beyond genetics. People focus on the genetics and get hung up on the fact that it's genetically modified food. To understand GMO foods, you have to back up a little bit and unpack what GMO is. So what genetically modified food is that plant geneticists find a gene that they can put into a plant that conveys a certain property to the plant. Just to use a human example, you could plug a gene into a human fetus and make the fetus have blue eyes or brown eyes or something like that, theoretically. It wouldn't be very ethical, but that's the biological operation. We know how to do it. So it would have been possible when this technology first came along in the 1990s to have come up with all sorts of marvelous foods. For example, geneticists could have plugged in genes that made it easy for plants to accumulate iron and zinc and calcium from the soil so that plants could be much more nutritious. They could have invented plants that could grow in a salt marsh, which would have fed millions of people in Bangladesh or some other coastal country where there's not much arable land. They could have come up with crops that are drought resistant, but instead they chose to come up with genes that conveyed resistance to herbicides. And you ask yourself, why in the world would the people that make genetically modified plants pick that gene? Well, it turns out the people that sell genetically modified seeds are Monsanto and Bayer, the very same companies that produce the herbicides. And so what these very clever people did was they said, let's put a gene into corn and soybeans and other crops that can resist herbicide. So then the farmer plants the seed in the ground, the corn grows up. Of course, the weeds come up too. But now the farmer no longer has to go up and down the rows with a hoe or a tractor. Instead, he can just put a tank of glyphosate Roundup on the back of the tractor and run up and down the field, spray the herbicide, kills the weeds, and the corn or the soybeans or the sugar beets are still there. It worked out great. For the first few years, the farmers loved it. But weeds are smart. They're like bacteria. And if you hit them with enough toxin over a span of 5 or 10 years, they start to mutate, evolutionary pressure. And now there are something like 100,000 acres of land in the United States that are covered with glyphosate-resistant weeds. And so what Dow and Monsanto are doing now is they're introducing new genes into plants, which are called stacked resistance genes, which enable the plants to resist not only glyphosate, but also 2,4-D, that Vietnam era toxin, dicamba, which is another one, and I think there's a few more on the horizon. And so they're putting these new genes in that enable the plants to withstand assaults by 3 or 4 herbicides at the same time. And because of the growth of the weeds, those herbicides are being applied in greater and greater quantities. And what this means now is that the herbicides are getting into the food, into the corn, into the soybeans, and they're still in the corn and soybeans at harvest, which means they come through into the food that we eat. And more surveys are detecting glyphosate in all kinds of foods that people eat, except for organic foods. And they're detecting glyphosate and its metabolites in human urine. So we've got a big problem on our hands here. It's not the GMO foods, it's the herbicides that go with them. And the major herbicide that's used on GMO foods is glyphosate, Roundup. In 2015, the World Health Organization determined that glyphosate is a probable human carcinogen. And I believe the state of California also classifies glyphosate as a human carcinogen. So here we have a chemical compound that's a human carcinogen that's being sprayed on food crops that we're eating. There's something wrong with this picture. Monsanto, of course, has denied the allegation that the chemical causes cancer, but since 2015, when the WHO report came out, there's actually been more research which has doubled down on the finding and reconfirmed it. So I think the likelihood that this chemical is a human carcinogen is probably very, very high, and we need rather urgently to begin to regulate this practice.
Yeah, I appreciate those comments. And I think a lot of people would say there are other issues with it in terms of novel proteins that are created, allergenic proteins, and also the fact that the genes are owned by these companies. So it really is an issue of corporate influence over the entire food production and pollutants. I mean, there's been lawsuits saying your genetically modified corn has now taken over my organic field, and now I no longer have a farm. So there are a lot of huge issues with regards to genetically modified food. So I appreciate your comments, Dr. Landrigan. Thank you. I think that we are out of time here, and I can't thank you enough for both of your presentations and the question and answer, which I mean, all of it was fascinating and interesting, and I'm sure people will want to watch this video again and ask others to watch it. So I really am so pleased to have you both here tonight. I want to let everybody know that these webinars are recorded. They're going to be up on the website at the SCCMA probably tomorrow or the next day in the front, and also the front page of the website at sccma.org. We have our next webinar in June 3rd with Dr. Ted Shetler, and that's going to be at 6 p.m. And you can email Samira at sccma.org for registering for that event. And I just want to say thank you again for this fabulous presentation. Everybody is pleased. We have many comments on the Q&A about it, and just fabulous. So thank you very much.
Thank you, and thanks to all the good people that stayed with us, all 19 of you right to the bitter end. So this is good. Yeah.
All righty, take care. Have a good evening.
Bye-bye. Thank you.
Thanks, Cindy. Thanks, Phil.
Thank
Nice
you
to
so much,
meet you.
Gina. Thanks,
Yeah,
Dr.
bye-bye.
Landrigan. Thank you.